Good afternoon, ladies and gentlemen. In the 28 years of existence of Alzheimer's Disease International, one of the major breakthrough that has happened is the release of the WHO ADI report, which speaks on dementia, a public health priority. And this is basically a call for action to the world governments to make dementia a health priority. We are living in a very, fast-changing world where borders are breaking down, the economic orders are reversed, there is economic crisis in many parts of the world. But the fact remains that dementia, the number of people with dementia is increasing the world over, and the dementia care is becoming more and more challenging. Alzheimer's Disease International, which is a world federation of 78 national Alzheimer's associations, and which is an umbrella organization established in 1984. The aim is to help establish and strengthen Alzheimer's associations the world over, and to raise global awareness about Alzheimer's disease and to make dementia a global health priority. As you can see from this slide, that we are spread across the globe, excepting in the continent of Africa and the Middle East, where we are making slow progress, but it's also happening now. As I said, this is the report which was released in April 2012. The title of the report is Dementia, a Public Health Priority. Dementia is a public health challenge because the world population is growing. As you can see from this slide, it is actually going from around 600 million in 2000, and which is going to be more than 1,500 million in 2050. The number of older persons has more than tripled since 1950, and it will almost triple again by 2050. Dementia is a public health challenge because the high burden and daunting cost. It is a major cause of disability in later life, accounting for over 11.9% of years lived with disability, and the extreme impact on the caregivers, families, and the society. And the lack of awareness and understanding of dementia at some level by all. Often in many parts of the world it is considered as normal part of aging. The way this report was developed, which is based on information from 3 sources, and more than 100 experts were involved in making this report. The report, there were 4 working groups which were involved in making this report, and it was done with an online survey in 30 countries, and all the key stakeholders were involved in this process. There are 36 million people estimated to be living in the world with dementia as on 2010. There are 7.7 million new cases of dementia each year, implying that there is a new case of dementia somewhere in the world every 4 seconds. The accelerating rates of dementia are cause of immediate action, especially in the low and the middle income countries where the resources are limited. As you can see, from 36 million in 2010, it is estimated to go to 66 million by 2030 and 115 million by 2050. We need to prepare. There has to be some kind of a preparedness, dementia preparedness by the member countries in order to make dementia a health priority. And this has to be done by the world governments. There has to be sustained action across the globe at international, national, and subnational levels. As you've heard about the national plans, there are countries which also require subnational plans, maybe at the level of state, at the state level or at district levels. So with this, I invite Marc to continue with the presentation.
Yeah, thank you, Jacob. We do a co-presentation because we are in the lucky situation that our chairman from India is here today. And actually, this plan was the same way developed as the plan about the intellectual disabilities. So with a lot of experts, everyone working for free. And everyone in WHO now asks the office that guided this, how did you do that without any money? Anyway, the priority areas of the plan are these. It's awareness raising, diagnosis, commitment to good quality of care and services, caregiver support, training of the professional workforce, social and financial support, recognition of rights of people with dementia, and prevention and research. And this is sort of a shopping list, but if you look for a national plan in your country and you want to know what are the areas, then this is a very good list that you can use. So some of the work is already done by this report, and there are many examples of good practices from different parts of the world in how to do the action. We were happy that the Director General of the WHO, Dr. Margaret Chen, wrote the foreword of the report, and she said, "I call upon all stakeholders to make health and social care systems informed and responsive to this impending threat." But we had to chase her for a couple of years before this happened. So at ADI we have discussed with the WHO what are the follow-up actions of this plan. And one of the first things that needs to happen outside of dissemination, and today you could say is a dissemination to this audience, is translate a report into a number of different languages. The Chinese translation will be ready in the next few weeks and will be launched at the Asia Pacific Conference end of October. And people are working on a Spanish and Arabic translation, and French and German are also on the list. So hopefully in the next months that will happen as well. So that it's really available for everybody, at least for the bigger languages of the world. The World Health Organization is giving technical assistance to countries that want to do the planning. In most countries, around 150 countries, there is an office of the World Health Organization. Only in the highest income countries not, because they should be able to do it themselves. ADI is working together with other NGOs, for instance Help Age International and other organizations, where we can support this process in a number of countries. And there will also start a project about online support for caregivers in multiple languages and in a way that it can become available in different parts of the world. And finally, there is an effort from the World Health Organization to look at the global research agenda. What are the priorities, and how can we give that a push from the World Health Organization, because that's an area in the report that is not so much touched on. And finally, there will be periodic follow-up reports to see how the implementation goes. When we started this whole process around 4 years ago to get this report, we had the belief that the World Health Organization is crucial for many countries. If they make dementia a priority, it will encourage governments, national governments, to make it a priority as well, to put together a national plan, and in some cases to break that down into subnational plans and create capacity and service development. And we actually see that it's happening, because this report seems to be very powerful, and in countries that never looked at dementia before, they now start thinking about putting together a plan. So that's very encouraging. For ourselves as an organization, the future policy objectives are those. We think that every country should have a national Alzheimer or dementia plan, that the World Health Organization report provides the tools and examples, so it can be used in putting together those plans. We feel that Alzheimer's disease and dementia should be recognized as the 5th major non-communicable disease. There are 4 now: diabetes, heart, lung diseases, and cancer. And we share with many other disease areas the same risk factors, and it would be a good thing for the health planning if dementia gets on that list as well. So therefore we are a partner in the NCD Alliance, and we want to continue to do that. And finally, these non-communicable diseases, the chronic diseases that already form the majority of the diseases that people die from in the world, should be part of the next Millennium Development Program of the United Nations, a process that is starting now, and by 2015 there will be a decision on new MDGs, as they are called. Finally, I want to invite you for the next big Alzheimer conference, that's the ADI conference in April 2013 in Taipei, Taiwan. Thank you very much.